So for my skill that we learned in 30/20, I'm going to be initiating IV fluids on a patient who already has an IV. And so first thing I would do is when I get the order, I would check in the MAR and just make sure that the patient is getting it for a correct reason. Like, I can understand the doctor's reasoning for giving it. If not, I would contact the provider and get reasoning. Also just making sure that it's not contraindicated in the patient, like not wanting to bolus a patient if they have chronic heart failure or something like that, or congestive heart failure. And so after that, I would then go to the room with all my supplies. I have everything set up here on the chair, so I'd make sure I gather all of that. And I would knock on the door, perform hand hygiene, walk in and just kind of explain to the patient what I'm doing, why I'm doing it. A lot of times it's just, maybe they're not drinking much, or maybe they're just dehydrated, so we need to put some more fluid in them. And then what I would do is I would get name, date of birth, to get 2 patient identifiers. If they were not able to give that to me because of like cognitive deficiencies or anything, then I would just check the armband. And so then what I would do is I've got my bag of fluid here. I would throw on my gloves. These are in the sterile gloves, but I wouldn't need sterile for this right now, but we're going to pretend it's normal gloves. And so I have my bag of fluid right here that I'm just going to cut open to where then I can rip this open and get to it. I would toss that in the trash as well. And what I can do is I can actually hang that for right now while I grab my tubing that I'm going to need. So I would bust open this tubing. Not good. Tear off all those. Make sure that it's not going to fall on the ground, and also that it's not clamped off at a bunch of different places. I can clamp it right here on the roller just to make sure that I have control of it before just opening it fully to prime it. And so then what I would do is I can take it off of here, actually, and take off the cap. Now that I've taken off the cap, I want to be sure that I'm not sticking anything that's unsterile in there. So I'm going to take off the cap of the spike as well. And then going to grab the end of this tube and then push down and give it kind of like a twist motion. And that gets that in there for me. And now I could hang it up. And so then what I need to make sure that I'm doing is that I have this positioned to where it can be primed. And so for that, I'm going to be taking off the cap that's on the end here, and I'm being sure that I'm not reaching in there at all, and also that I'm not contaminating the end of this cap, because I'm going to recap it again so that way I can get the IV clean. And so then I would fill this up to about halfway, and then I would open up my clamp here, and I have a trash can down here to kind of help with the fluid and everything. So at that point, I've ran it through and I don't see any significant air bubbles. And so at that point, then this cap would go back on here, and I've made sure that I've not touched the sterile end of it. And so then what I would do is I'm gonna hang it there for my sake right now. So then I would have my flush ready, be sure that it's primed and ready to go. And then I would take the patient's IV. I'll just pretend this is the IV because this is a J-lube, so we'll just... And so then what I would do is I would just flush it a little bit. Some places tell you to kind of aspirate on it a little bit and see if you get blood return. And so I would flush that about halfway. Oh, and I almost forgot. Oh, I would use my alcohol prep pad first to clean the access site, and then hook up my sterile end of my syringe onto there, and then I would flush it. And then what I could do is I could leave this end hooked up into the patient for now, and then I could take my infusion here, and again staying on the not sterile end of this cap. And then what I could do is I could just unhook my saline syringe, and then we already cleaned this with alcohol, so then I could connect it. And then at that point, we'll just act like we're hooking this up to gravity. Then I could just slowly open it up. And then for gravity, I would stay in here for a little bit and just watch how many drops we're getting per minute. And I would fluctuate the roller clamp depending on how many drops that I would like per minute. If I was just doing a pump infusion, then I could just hook it into the pump and just program it that way with how many milliliters I want per hour. But then after that, I would take off my gloves. I would make sure that it's flowing properly. I would check back on the patient pretty soon afterward, just to ensure that there was no extravasation of the IV and that they're not having any redness or allergic reactions to it. And then that would be it for hooking up an IV to someone who already has an IV site.